Hello, everyone. Welcome to Adapting Class. Thank you for joining us. Now, if you're getting ready for your next generation NCLEX, you know how tricky those metrics questions can be, especially when they ask you in the figure form. We're going to break down these metrics. Basically, it's the same thing as select or apply. When you see it, take the box away and treat them as select or apply. But look, when you see it, don't panic. Treat it like any other question you've seen. Take away the table. What is he asking? Which of the following, read it like you read a regular question, are concerning or not concerning? Forget about it. Just say it's concerning. You're focusing on the concerning aspect of it. What is the question asking? And this is caring for a client experiencing asthma attack. So those are the two information. An asthma attack patient, which finding do you think is concerning? If it's concerning, you pick it. If it's not, you ignore it, right? They may give you two table and you have to select each one of them. But remember, is selected apply. So forget about it. All you need to do is say, tell yourself, I'm looking at this patient who is having asthma. What do you think? Audible wheezing. Is it concerning to you? Saturation of 91 on roommate. Is it concerning to you? If it's concerning, put down your answer. Put down your comment. I will read it and I will see what you're thinking. Drowsiness and confusion. Is this what you expect in a patient with asthma attack? And when you see it, should it worry you? Client requesting inhaler. Is that concerning to you? Retraction in the chest wall. What do you think? Pink, warm skin. An asthma patient who is having asthma attack and he has pink, warm skin. What do you think? You see, there's no trick answer. Forget about the table, like I said, and treat the question as if it's just there's no table. It's select or apply. You pick those you're confident, but for unfortunately, you have to select something at each row, right? Audible wheezing. When you see a patient with asthma, you expect them to be wheezing. Why would you say this is concerning? So this is not concerning, right? Saturation of 91 on room air is concerning for you for a patient who has asthma. So I'm going to select that. An asthma patient who is having asthma exacerbation and he has drowsiness, hey, I'm worried about it. That should be concerning to me. What do you think? The client is requesting inhaler. Do you think this is concerning? If you're taking care of the patient and is asking for inhaler, do you think it's concerning? Do you think it's concerning? Based on the content, you know an asthma patient who is having what? Um, attack and you see a pink warm skin, that means there's perfusion. This is not the problem. This is not concerning. If you see chest retraction, yeah, you have to worry about it. That is what? Respiratory distress. So this one is concerning. If the patient is requesting inhaler, that means they're maintaining well, they're doing good. This is not concerning. So this is the way you should be tackling these next generation questions. Think about it. Forget about the table. Treat them like what? Select or apply, and then answer them that way. Otherwise, they will trap you. But don't worry about the table. It's another form of putting uh, the information in the tabulated form, and then that will make you worry about it, right? Fine. Same thing. And then assessing a newborn 10-month-old after 10 minutes after delivery. A newborn 10 minutes after delivery. After delivery, 10 minutes. What do you think? Identify each finding is appropriate or require intervention. So if you are the nurse, you're seeing this patient is being born 10 minutes ago, and you examine the patient, which of these do you think this is an appropriate or require intervention? If you see bluish hands and feet, is it appropriate? If you see nasal flaring, do you think is appropriate in a newborn, 10 minutes old? Do you see positive Babinski reflex? Should he concern you? That means is he appropriate or inappropriate? If you see grunting respiration in a 10 minutes old baby, do you think this is appropriate or require intervention? If you see grunting, do you think it's an appropriate thing or require intervention? If you see heart rate of 140 in a 10-minute old baby, should you be worried about it? Is it appropriate or require an intervention? And a floppy muscle tone, should it concern you? Forget about the table. Like I said, this is designed to make you, don't forget, next generation, you're supposed to see these in the case study, but treat them like a select or apply and ignore them. So, bluish hands and feet is acrocyanosis. It's an expected finding on a new baby. Just let mommy warm them up. So, this is appropriate. It does not require intervention. Nasal flaring, what do you think? Nasal flaring. When you see nasal flaring in a 10 minutes old baby, that means they have a respiratory distress. This is requires some intervention. Positive Babinski. Babinski is normal in a 10 minutes old baby, right? It goes away after a couple of months. Sometimes you go through over 6 months, it will be there, right? But this is appropriate. Grunting in a newborn is respiratory, pending respiratory failure. It's worse than nasal flaring. So this requires some form of intervention. The heart rate of 140, that's what you expect. Baby heart rate is like 110 to 160 in a newborn, right? So this is appropriate. The nurse should not worry about it. A floppy muscle tone, what do you think? Floppy muscle tone indicate neurological problem. This is a neurological problem. So this one, we should intervene. And this is what they've been giving you in the NCLEX. When you're doing practice questions, this is what it look like. Forget about it. Treat them like a content. And so when you treat them like a content, you analyze it as if what? This patient is a newborn. What should I expect or I don't expect? Forget about whatever they will tell you. Intervene. Inappropriate. All this. Look at it the way your content makes sense to you. All they saying, do I see a bluish hands and feet in a newborn? Is he something that is expected or appropriate or whatever words they use? Ignore it. Treat them like one thing. Therefore, this is what you see. Same thing. This one is a little bit difficult. You got to look at it carefully. A client with type 1 diabetes reports symptoms. The client is telling you symptoms. I'm having these symptoms. For each, select if it is expected or unexpected. So you got to be careful. You don't get trapped, right? I have type 1 diabetes. And if I'm telling you these symptoms, should you worry about it or not? Expected or non-expected, it means are you worried about it or not? You got to be sharp, right? That means if the patient tell you after I eat, my glucose is 180, should you worry about it? I'm sweating and I'm having irritability. Should you worry about it? I have fruity what? Breath odor. Or should you worry about it? My blood glucose is 50. Should you worry about it? Lightheadedness before breakfast. Should you worry about it? You see the way I'm approaching it. I'm not, even if they give you a case study, ignore it. Think about it like this. Say it loud to your ears and say, hey, why would I worry about it? Should I intervene, right? If you eat right now and you have diabetes, your glucose is not going to be normal. So this is an expected finding, right? When you're sweaty, you have irritability, hey, you may be probably hypoglycemic. So not an expected finding. I shouldn't see that. When I see that, I should worry. If you have fruity breath odor, hey, you're getting DK. It's unexpected finding. If you feel a little bit thirsty after you exercise, yeah, you dehydrated. Diabetes patient is suspected. A glucose of 50 in a diabetes patient, bad, right? And when you're feeling dizzy, lightheaded before you eat breakfast, that means you have hypoglycemia. So not expected. But this is what he means, right? This is the way you have to reinterpret the question the way you can understand it. But this is a little bit difficult, but you have to know the content and put it together. I'm trying to emphasize some of the way they ask you this question and I give you the explanation. These are not expected symptoms in the client with diabetes. They indicate complication, sweaty, irritability. You have a light headedness before your breakfast, your food order, and your glucose is 50. Is all bad problem. How about this? You should be able to do this after these three questions. What do you think? For a client schedule, I don't want to give you a long question. I give you the gist. I call it the buzzword. When they give you a long question, rewrite it in these short sentences so that you focus on it. For the client, schedule for surgery, right? These are like standalone. Select if each nursing action is appropriate or inappropriate. If you are the nurse and you are about to what? Taking care of this patient is scheduled for surgery. Teaching incentive spirometer, is it appropriate or inappropriate? Encouraging oral fluid 2 hours before surgery, is it appropriate? Verifying if the patient has latest allergy, is it appropriate? Administer the prescribed anti-infective, is it appropriate? Shave operative site with a razor blade, is it appropriate? Obtain surgical consent, is it appropriate? What do you think? You've seen questions like that, right? This is in the table form. Take the table out and ask yourself, if I'm the nurse, the buzzword is action, is it appropriate or inappropriate? Do you teach the patient incentive spirometer? What do you think? That is a good thing to do. Appropriate. Patient is having surgery. Do you let them drink 2 hours before surgery? What do you think? Do you think it's a good thing? I don't think so. How about verifying if the patient have latest allergy before they go to surgery? Because they're going to wear gloves and operate on the patient. Therefore, that's a good thing. It's appropriate thing to do. Is it appropriate to give antibiotic to the patient that is scheduled or prescribed? Appropriate. What about it? Shave the operative site with a razor blade. What do you think? You can put down your answer. But think about it. What do you think? If you are the nurse, patient is going to have surgery. Are you going to shave the operative site with a razor blade? What do you think? They need the area to be shaved where they're going to operate. It's a trap. First of all, the nurse should not shave. The shaving has to be done in the operative room. And if you have to shave, you have to use electric blade, not razor blade, because this will lead to more infection. Therefore, this is inappropriate. Obtain surgical consent. What do you think? The nurse obtain surgical consent. These are questions you see in the standalone. The same thing. Now I put it in the table form. You shouldn't say, oh, I'm confused. It's in the table. I don't know what to do with it. Take the table out and say, tell yourself, would a nurse obtain a surgical consent? No, she's supposed to do what? Witness and verify. Verify that there's a consent, and if there's a consent, witness it. So this is inappropriate action by the nurse. That's all. You see, these questions are not that difficult, right? You should be able to master it easily. This is another one. It's a post-op patient. For each finding, select if it is expected or not expected. And then assesses a client 24 hours after appendectomy. So patient had surgery and they removed the appendix. 24 hours. Which of these are you going to expect in 24 hours? If you don't expect it, select it. If you do, but this is post-op, then bring your content. If patient has surgery after 24 hours, which of these are expected finding? And which finding, when I see it, I know it's a bad problem. So this is what you mean. If I see it, it's bad. right? Inappropriate or unexpected finding, that means patient is having issues. Will you see a temperature under 101.5? Do you see green drainage from the incision? Do you see absent bowel sounds? Do you see incisional pain? Can you see severe abdominal rigidity? Can you see decreased breath sound at the lung basis? Right? These are little things, right? Of course, they're going to have pain at where we did the incision. Of course, they are surgery, they are lung basis, they will have atelectasis. Every time they say decreased breath sound at lung basis, it's never a lung issue. They're not having respiratory issue. Any patient who had surgery is going to have decreased breath sound at lung basis. So this is expected finding. They may have low grade fever from the beginning, right? After surgery, right? They're not going to have bowel sound. So this is expected. If I see abdominal rigidity, that means complication. That's peritonitis. Bad problem. If I see some green stuff coming out from the incision, that's infection, right? Bad problem. And that's all, you're done. You see how you approach these questions. So don't worry about it. And the one. Last one, if you're online, I want you to give me answer for each of them and let's see if you got it. Identify finding that require notifying the HCP versus no action needed. What does that mean? Do you tell the doctor or intervene? Do you let them know about this patient condition or you just ignore it? A nurse is caring for a client, he has CHF, is receiving IV furosemide. This is pharmacology and content related, right? I have CHF and I'm getting what? IV furosemide. Which finding, when I see it, I should let the doctor know, or I should keep on seeing, following with the patient, monitoring. Potassium 3.1. Should you ignore it? Urine output of 40 ml every hour. I have muscle cramps. I have weight gain of 0.5 pound in 24 hours. I have small purple rash on the torso. And I have ringing in the ear. You see what I've done? I've given you signs and symptoms of furosemide, and they put it in a table form. You can't see this and just run away. You can't see them and look defeated. I don't want you to look at it and say defeated. And take the table out and said, if you take in furosemide, what should you see? If you take in furosemide and I see potassium 3.1, I should let the doctor know. I can't just ignore it. It's going down. If you are making urine 40 ml per hour, that is normal. It's normal if you're getting furosemide. So no action needed. How about muscle cramp? If you taking what? Potassium, furosemide, and you see what? Muscle cramp. Should I let the doctor know? Or should I just say, okay, muscle cramp. I'm having muscle cramp and I'm on IV furosemide for CHF. Muscle cramp. I should let the doctor know. He increase what? Indicate potassium. If I gain what? 2.5 pound in 24 hours, that's no CHF. I'm doing well. So this is fine. How about small purple rash on the torso? I'm getting IV furosemide. If I'm receiving IV furosemide and I see small purple rash on the torso, what do you think? Should I worry about it? Should I let the doctor know? Or should I just ignore it and document and move on? This is Stevie Johnson syndrome. Notify the doctor. If I see ringing in the ear of the patient, what would you do? Ringing in the ear in the patient, what do you think I should do? Ringing in the ear. That is ototosity. One of the early signs of ototosity. If you get in IV furosemide, let the doctor know. These are 6 questions, just a short one, But you can see this matrix grade is nothing. It's selected apply in disguise, take the table out. Most of them intervention, immediate intervention, action you need to do. It does not matter what words they use there. You can come up with your own word and you say concerning or not concerning or to intervene. I would just pick two words, either concerning or not concerning, or intervene or not to intervene, which is the same thing. Appropriate, inappropriate. They are just bunch of words. They are the same. Treat them as either you intervene or you don't intervene. Either is appropriate, not appropriate. Anything that is appropriate, that means it's not concerning. Anything that is appropriate, you don't need to intervene, right? Anything that is appropriate, there's no action. So whatever adjective that they put there, it does not matter. One of them means it's concerning, the other one is not concerning. Treat it like that. And then you'll be able to answer this matrix grade, select or apply in disguise. This is our depth and class. Thank you for watching. And if you like this video, put a like button on. If you're on the line, just click the like button or subscribe to Adapt and Class or join our membership. But good luck. And then if you want to learn more, you can join our crash course coming up. Take care of yourself. And then once again, don't stop charging. Never stop charging. Keep on charging. And good luck in your exams.